apologies from Elliot King.
Right.
They're the only apologies. Shall I run through the attendance?
Yes, please, if you would.
Okay, if I start with the panel members first. Cyril Anderson. Mike Day.
Yeah.
Mike Dirk.
Yes, I'm here.
Kevin Griffiths.
Yes, I'm here.
Paxton Hood-Williams.
Yes, indeed.
Yvonne Jardine. Susan Jones.
Yes, I'm here.
Erica Kirshner.
Yes, I'm here, thanks.
Wendy Lewis.
Yes, I'm here.
Des Thomas. No. And Mary Jones is joining the panel today.
Yes, I'm here. Thank you very much.
Okay. And then if I go through everyone else, so Dave Howes.
Present.
Okay. Julie Davis.
Hi, I'm here.
Joanne Abbott Davis.
Yes, I'm here.
Okay. Isabel Davey. Helen Osborne.
Yes, I'm here.
Gavin Evans.
Yeah, I'm here.
Jay McCabe.
Yep, I'm present.
And Helen Williams.
Oh, just to let you know, Liz, Helen will be joining us when we cover the section on our report in a little bit.
Okay, thank you. Okay, thanks very much.
Okay, we'll stay with you for item 2 as well, if we may, Liz.
Yeah, okay. The item is confirmation of convener. At the beginning of every municipal year, we have to confirm the convener. Councillor Hood-Williams is happy to continue in the role. Are panel members happy to confirm him as convener?
Yes.
Yes.
That's great.
Yes.
Thanks very much. Lovely, thank you. Okay, if we can move on to item 3 then.
Okay, before go on. Before I go on to item 3, then let me just say first of all, thank you very much for that anyway. And also let me welcome all the members to this meeting of the panel and the new municipal year, if I can get that right, the first one. And obviously we also have a number of officers as well, and you can see from the agenda, and most of them have said they're here, as well as Julie Davis and Joanne Abbott Davis. We also have Isabel Davey, Helen Osborne and Gavin Evans supporting them, and from the youth justice system we have Jay McCabe supported by Helen Williams. I'm sure that Dave Howes is somewhere around there who's going to be doing some talking before the day is out. We also finally I would like to welcome the Lord Mayor, Mary Jones, who was installed last Friday, and it's my pleasure to congratulate you, Mary, on achieving that prestigious honour. And Mary is here today because she chaired the original scrutiny inquiry into CAMS, and a number of years ago, I can't remember how many it was, Mary, to say, but she also has been coming regularly to Child and Family Services whenever we discuss CAMS. So it's very important that she's here, and we're very pleased to have the Lord Mayor. It's not often that we get the Lord Mayor attending our meetings, so that's a plus. Okay, obviously one of the apologies we've had is from Elliot King. He's obviously not been very well, but I'm sure you will want to join me in sending our very best wishes to him and hope you see him again soon. And basically, I think that's all I need to say in terms of welcome. That was quite long because there's quite a lot of officers here. We're very pleased to see you, and we always like to see that support coming in. Item 3 then is disclosure of personal and prejudicial interests. Has anybody got interest they want to declare at this stage? No, that's fine. It would be most unusual if it was, I guess. Item 5 is minutes of the previous meetings, and you've probably had a chance to have a look at those and read them. And if you have any comments that you want to make at this time, this is your opportunity so to do. The only thing I will say is that following the meeting, the cabinet member Louise Gibbard asked if we could send the minutes on, I think it was, Liz, to the Welsh Government, because we were obviously very supportive of her and the department at that point in time, and obviously we agreed to do that. So that's all I really want to say in that respect, unless anybody wants to add anything. Item 6 is public question time. I don't know if we have any questions, Liz.
No questions have been submitted.
Okay, so that's holding us up for a long time. Well, that means us on straight away to item 7. Please, if we may, update on progress with child and adolescent mental health. I assume Joanne and Julie are going to be presenting this. I don't know if anybody like David wants to say anything beforehand, or is it straight over to you, Julie?
I'm happy for it to come straight over to me unless Dave did want to chip in, but I'm sure he'll chip in as we go along.
Absolutely, Chair.
Thanks, Dave. So I'm really pleased that we've got this update on CAMS today, and we've worked very closely between local authority education and health colleagues to put together a joint presentation to give you a comprehensive and I think really informative overview of the progress we've made, particularly over the last year through very challenging times that we've all experienced. And it's really pleasing to see that we are getting better at working much more closely together and aligning our strategic priorities to ensure we deliver the best outcomes possible for children and young people across Swansea. So what we're going to do is I'm giving you a bit of a preamble now, then Gavin will just give you some heads up on what we're going to talk to you about and helpfully take us through the presentation, and then Gavin will hand over to Joe, and then we'll have some further input at the end from the colleagues that are attending today, from Isabel and Helen in particular. So I'll hand over to Gavin now, and then we'll start the seamless transition into the wider presentation. Thank you.
Okay. Thank you, Julie. Gavin?
Fab, thanks, Julie. Am I on screen share?
You are? Well, yes.
Excellent. Sorry, I've got a bit of tech.
Like, it's big enough to figure now as well.
There we are. I'll see if I can get it even bigger.
That's very good.
How's that? So as Julie said, we're going to attempt a little bit of a tag team. It's kind of representative of the partnership that work that we've been doing. So we thought it would be important to present it that way. So I think the last time we came, you'd have seen it as separate reports. So hopefully it's representative of the way in which we are joining up our work. So Julie's just given you a quick introduction, a little bit of background. Thought it would be important just to cover a little bit of, obviously, since we last saw you, we've had a fairly busy year in terms of COVID, so a little bit about some of the impact of that. And obviously that will be a bit of a theme as we go through the slides into individual areas as well. So health actually lead the overarching partnership. So at that point, I'll hand over to Jo, and she will give you some detail about the kind of strategic partnership and some of the subgroups that we all that enable us to begin to work together on this agenda. And they'll also be covering some of the initiatives that we've been working on together. And then we'll go into some of the more individual kind of service areas. So in terms of CAMS, around the performance and the updates there. And I know Jo and Isabel David will be joining Jo there to talk us through some of that. Then I'm going to talk you through some of the more child and family specific updates. We have Helen Osborne here from Education, who'll take you through some of the specific education updates. And then we'll kind of round off with some kind of collective opportunities and challenges. So there'll be a good opportunity at the end to ask questions, but I'm sure it's fine if you want to pick up on anything specific as we go. Okay.
Okay. Yeah.
So, you know, some of these are obvious, but we thought it'd be important to just kind of point a few out. You know, from our last update here, we did have a lot of partnership work ongoing and a number of projects, and you know, throughout the pandemic, there has been some disruption to that and our ability to bring everything together at the same pace. So some of the pace of that has changed. You will hear a little bit more about the impact in terms of demand as we go through the presentation as well. but we have, as it's progressed, seen some increase in demand for both some of our emotional health services and our mental health services. And it's obviously important to point out that although we have been endeavouring to understand the impact that this has had on our children and young people in terms of the pandemic, that's obviously been emerging, and we are really still within the aspects of the pandemic. So it's been critically important that we've tried to learn as we go and continuing to do so as well. There's been a number of small pieces of research carried out, some smaller pieces within Swansea itself. So we've had some feedback through schools about the kind of impact that they've seen on our children and young people. With our school counselling service have as well. But probably one of the bigger pieces that we thought we'd just highlight to you was carried out by the Children's Commissioner, and they fairly recently released their report on the coronavirus and me. So there's quite a comprehensive report there. So if you did want to look further into that, you can find that on the Children's Commissioner's page on the website. And you can see that there's a little bit of feedback more specifically here about emotional and mental health support and some of the impact there for our children and young people, and in particular who they felt confident in terms of where they would go to get help from. So you can kind of see, friends and family are right up there as you move through that, particularly into sort of mental health teams in our areas and school counselling, that the percentages are gradually becoming slightly lower. So that's something for us to think about, particularly in terms of our accessibility. And that's been one of the things that's been really important in our response, is how we make sure that all of our services have been accessible to children and young people throughout a really unique and challenging time for everybody. But again, as we go through some of the individual services, then we'll also be giving you, some further updates on those kind of areas. Okay, so at this point, I'm going to hand over to Jo, and she's going to talk to you a little bit about our overarching partnership and how that's been progressing.
Thanks, Gavin. That's really helpful. And I think we've been increasingly working together and increasingly trying to focus particularly on building services around children and young people. And I think, as that previous slide showed, we're very mindful that there isn't one size fits all, that there has to actually be a range of options open to people and to our children and young people, to make sure that the most appropriate way that they feel able to access services is actually available. And we know from the No Wrong Door report and previous conversations, lots of frustrations about people being bounced around the system. And we've tried very hard to make sure that the work we're doing joins up and integrates the services we provide and stops there being gaps. And as Julie said, we're not 100% there yet. It is a journey, and trying to fix some of the particularly entrenched problems around this will take a bit of time. So just to give a bit of background, we established a planning arrangement under the Regional Partnership Board, originally under Western Bay and now West Glamorgan, focusing on emotional health and well-being for children and young people. And that includes CAMHS, but it very importantly is not just about CAMHS. It is about the whole offer, which is available for children and young people. And that was very much about making sure that there was a clear recognition this was not a single agency response that was needed, it was a multi-agency response, and we were only going to really be able to address the issues of our children and young people if we did that together. So we developed a 3-year delivery plan for 2018 to 21. That was agreed and has been implemented. As Gavin has said, clearly COVID has had some impacts on that. Interestingly, some positive in terms of our ability to accelerate some things, but also some impacts on slowing things down, and obviously also around the demands on the service. So we are in the process at the moment of developing a new delivery plan that will run from this year for 3 years again. So that's very much building on the progress we've made to date, but actually identifying the further work that needs to be done. And that's very key and will tie into various government initiatives. I've just come from the launch of the NEST framework, which will be one of the requirements around that. So that will be a key component of that. So we have been continuing with the multi-agencies discussions around how we can actually improve access and make sure we get access to services at the right time in the right place, and that we don't have people ping-ponging around the system as perhaps has been the case in the past. We have developed what was planned anyway, which was a regional model for CAMS response, and also for delivering the offer so that it is consistent across the region. And whilst the way in which that is delivered in the two local authority areas may be different, what is being delivered is the same, so that there is the same availability for people, even if the process around that is slightly different. And we are looking to actually complete, if you like, the work around actually mapping the services that we have in each area at each level of the model, looking at our demand and capacity and mapping that against what we have available to make sure we're identifying any gaps in that, and making sure that we're focusing on plugging those gaps, and also recognizing that we know from what evidence there already is around about the impacts of COVID, that providing a wider range of psychological therapies and input for children and young people is likely to be a particular growth area. So what we have managed to do, in spite of COVID, is that actually that gave us an opportunity to implement a single point of access for CAMS ahead of target. So that happened in March 2020, and that means we have a phone line which is available 5 days a week, 9 to 5, with an experienced CAMS worker on the end of that phone who can take any queries, be it from professionals in schools, from GPs, from social care staff, and indeed from children themselves and their families, in terms of needing support and advice about what is the best impact, the best service to provide support for them. And that can result in some short interventions immediately, might result in referral, it might result in coordination with other services about lower level support available. But it is a single place that people can go, so they're not going to the GP, getting referred to CAMS, then being told it's the wrong bit of CAMS, then going to a different bit of CAMS who then say they don't meet the referral criteria, which is some of the historical behaviours that we were seeing. There's also been investment by partners to increase support in all settings, including school counselling, so that the availability of offer is greater across the board. And it's not just about the specialist CAMS, but it's about making sure people have and children have the right support at the level that they need. One of the feedbacks from a lot of children and young people was that they felt that the only option a few years ago was CAMS, and then a lot of the time they weren't meeting the criteria. But there was also a stigma about being referred to CAMS services that a lot of young people wanted to avoid if at all possible. And so part of our changes in our plans is about making sure that those with the highest level of need get that provision supported completely appropriate by CAMS, but where possible we can divert them and provide support for them in other settings. And we've got plans also underway to provide support for emotional health and well-being, including joint agency development of tier 1 and 2 interventions, so that we're not referring kids into CAMS unnecessarily and when that's not the most appropriate. So it would be fair to say particularly those joint service elements slowed down a bit because of COVID, just because obviously we were either responding to other priorities or other issues, or indeed just because we're, the difficulties of actually, until we all got terribly IT literate, as we all are here clearly, and managed to get on board with the whole online approach. So in terms of that, we have also put in additional primary CAM staff, utilising some additional Welsh Government service improvement monies. We have now, I think when I talked last time, I was talking about our aspiration to develop the CAM's 3 small teams into an integrated team. And part of the enabler for that is actually about having CAMS sort of centre for the management of the CAMS, so all the admin support and such like. That has now happened and is now centralised on the Neath Talbot Hospital site. So all those staff are working together consistently there now. That's enabled Fairfield, which was one of the buildings on the way up to Kevin Coy, to close. Children from the Neath Talbot area are now consistently being seen in the Children's Development Centre at Neath Talbot Hospital. And we are just about to open, in a couple of weeks' time, a new facility on the Kingsway, which has been named by children that have participated in services in the past, and that will allow Trehavod to close. If you remember, I think last time I talked, I fed back the feedback from children about their reluctance to go to Trehavod because of its base on the Kevin Coyd site and being seen as a, clearly badged as a mental health patient then. The aim of this is a building next door to Information. So it's trying to build on that as part of, that's just an acceptable hub where kids go to get support for a variety of things. And so there's lots of reasons that they could be there. So making it less stigmatized, and it's obviously easier for them to make their own way there as well. So we're not having to rely on them being taken to appointments all the time. We've also had the recruitment of emotional health and wellbeing officers, and that's supporting the liaison model that you remember we put in with ICF funding, so that actually we have a CAMS worker in the front door and the intake teams of the 2 local authorities, so that they are there available for advice, support and guidance around best care provision for children identified there. And again, that's focused on more psychological therapeutic input as well. So within the delivery plan, we had a number of strategic objectives and a number of ways that we were delivering that, and the work streams. So in terms of holding this all together, so we have the emotional health and wellbeing for children and young people planning group, which oversees all of this. And then there are components. So we have a CAMS commissioning meeting, which commissions services directly with Cwmtaf Health Board, who provide the services for the Swansea Bay area. So that's very much our performance management meeting in terms of ensuring that services are being delivered for our population. We then have the work stream looking at complex care, which is actually trying to look particularly at how we make sure that children in the highest level of need get the support they need, and wherever possible as locally as they need. Then we have the children's services input, particularly around neurodevelopmental disorders and improvements around that. Then we also have one around the access to support for emotional health and wellbeing, and that's around the Tier 1 and the universal services supporting the other more specialist services, and also training needs for professionals across all professional groups. Improved access to psychological therapies, and that's being led by one of the psychologists in terms of looking at making sure that the therapies are aligned with the matrix plant guidance from Welsh Government, And again, mapping what we've got, looking at the gaps and trying to identify how to fill those. And then we also have an engagement and experience work stream, which is being set up, which is around trying to make sure that we've got better and more ongoing processes for children and young people to be directly involved in the development of these plans. We have lots of mechanisms, but they're not necessarily as joined up or as direct as we would like. And I think in relation to all of those things, we've, through the monitoring, through the planning group, we've tried to check progress and make sure that those are developing at pace and appropriate pace around that, but they all contribute to the overall vision of making sure we've got the right offer available for our children and young people.
Can I give you a break for a second, Joanne, and say, would it be a sensible point, just any questions on that section, if any members have any? Sue?
Thank you. I just wondered about the Neurology Development Service, and I know that at one time referrals were waiting 26, 28 weeks to get any type of input. Has that improved now?
Ironically, it improved, but it's deteriorated again, to be honest. So it improved initially, and the target was that 80% of assessments for neurodevelopmental disorders would be completed within 6 months. And for about a period of about a year, that was achieved. And so all those assessments would be done within 6 months. For a variety of reasons, and this isn't just a Swansea issue, but across the whole of Wales, the increase in referrals has gone up massively. There's been about a 3-time increase in referrals, and services across Wales have massively struggled to keep up with that demand. So our waiting times at the moment are significantly longer than that. Again, not to the level you're talking about, but they have gone past the 6 months wait period. And there are discussions at the moment, both at an all Wales level, because there's an all Wales neurodevelopmental group looking at what can be done, because it seems to be an all Wales picture, so it's not just locally, to actually see whether there are changes that need to be made to the new service model that was brought in around actually how those assessments could be implemented. So the performance is not where we would want it to be, definitely. It's not that this is any reassurance, it's not as bad as some areas, but we have looked at a variety of ways of improving that. We recruited some additional staff in the start of 2020 to bolster the areas where there seemed to be some bottlenecks. Again, that improved things, but there's still a gap between the number of referrals we've got coming in and the number of children that we're able to assess with the number of staff that we have to the level which the guidance says we should. So so we are keeping it under review. It was one of the areas that was identified as a priority within our annual plan. We're just looking at what that means in reality in terms of what additional support. And the other complication is that there's quite a dearth of staff in that area. So it's not an area that's easy to recruit into either in all instances. So it's a bit of a perfect storm, to be honest. So definitely in need of improvement, and we are keeping a close watch on it, but it's not easily resolved.
Thank you.
Okay, Mary Jones.
Thank you, Chair, and thank you for your kind words at the beginning. Can I, before I ask my question, just thank everybody for actually taking on board what Scrutiny actually recommended when we did the first CAMS. It was really interesting to hear that you have got the model now that people can access for advice and be signposted to the correct service that they need, because that was one of the biggest things. People thought they had to have CAMHS to get help, and then they said they had the stigma then of CAMHS, so it was really a bit of a vicious circle. But going on from Sue's point, really, is Councillor Susan Jones. Tirmesul, I think you said it was called on the Kingsway. If I'm correct, Infonation is a drop-in centre, but I'm assuming this isn't going to be able to be a drop-in centre. It'll be appointment only. So the correlation is, I know you don't want people to go to Kevin Coyd and they didn't like going up there, but really it's not going to be as accessible then as Infonation. And then because you haven't got the staffing, how successful is this going to be? If it's appointments only, people are going to see it there and then perhaps get frustrated that they can't get the help that they need.
I think that there's two elements about this. I think one, in the first instance, it's clearly there for us relocating from Trehavard. I think we've already started conversations about how can we best integrate and link the services between and the benefits of having Infonation there alongside those services, and how can we develop that. And clearly we've got a range of other services that we have and are developing, and there are options about some of those being available at that site. So it's very much, I suppose, early days in the sense that we'd planned to settle in the specialist CAMHS element of it and the appointments bit and the relocation from Trehavard. But there are facilities there that could then be utilised for a wider range of services. And as we are expecting and know there will be monies coming this year, which will enable us to further plug some of the gaps within that we've identified in the delivery plan, there are options around that. And I know Gavin and I have had some initial conversations about trying to get a closer alignment about what those opportunities might be. Because we have other health services providing services into Infonation, so there are clear opportunities there.
Okay, Mike Dirk.
Thank you, Chair. I struggle sometimes when I listen to this because I had old experience. I'm going to mention it again. I'm sorry about that. But 20 years ago, working for the Welsh Government as a team leader in Child and Family Social Services, everybody's business was published 20 years ago. Child and Adolescent Mental Health Strategy. The language we use, this could be a recording from 20 years ago. With respect. Strategy, 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 matrix, Welsh Government guidance. We have gaps in the service. We need to change. We are not meeting the needs of vulnerable children and young people. So my question is this. What are the key performance indicators that we are going to be measured by as we move forward now? Not strategy, practical, local action and delivery. What are those key performance indicators that we will be able to point at and show the success of much needed core services for, as I say, the most vulnerable children and young people that we have in Swansea and our region? Thank you.
Yeah, I don't know whether it's worth holding that question and going through the rest of the presentation, because we haven't actually got to the metrics bit of it yet. And that may or may not answer your question in terms of those things that we monitor in terms of that. And I fully accept the, I remember the reports coming out as well. And from that point of view, this, I suppose, this has been a journey we've been on for 3 years. That's the, if perhaps we should have been on that journey beforehand, but I think in fairness, we've been on this journey for 3 years. So I can't comment on before that, but I think, we are committed to, and maybe it is, we should have done it a long time ago. I don't know, but in reality, we are where we are, and we're very keen to make progress and to make progress together. So can I hold your question and then perhaps go back to it at the end and see whether we've addressed that as we go through? Is that okay?
Well, I'll just add to that and say I'm sure eventually we will expect to see figures coming through in the performance reports on a monthly basis, and that would be interesting for us to see, I think, Mike. I think that's what we're looking for as much as anything else. One general question, if I may. Single point of access, phone line, 5 days a week, not 7.
No, 5.
What's supposed to happen on the other 2 days?
If there are crises or there are children and people that need support, there is a crisis service. This was more around a lot of the feedback we had was around professionals saying, we have a child or a young person in front of us, we need to get some advice, we don't know how to do it, we haven't got a mechanism. So it was to particularly respond to that rather than a crisis situation occurring over the weekend. So that was the logic, really. Previously, I think it was 2 hours, one morning a week that was available for that advice. So it's expanded that. We will keep it under review, as we do with all the things we do, to see whether there is further opportunity to learn and do differently. But at this time, we decided the first stage was to expand it from, as I say, the couple of hours a week to 5 days a week, 9 to 5. As the next logical step.
Okay, and I find it slightly ironic again that having lost Bridgend, in that sense, I don't know whether that made a significant difference as far as you were concerned, we're still relying on Cumtaf to provide the service at the end of the day.
Yeah, and that was
seems to be a bit of an anomaly.
No, it's not an anomaly. It was a Welsh Government directive at the time. For those of you that remember, I remember when the CAM services were provided by every hospital. I remember when Singleton had its own CAM service. They were taken out of individual hospitals because they were so flaky. You couldn't get the staff, you couldn't keep the staff. The clinical governance around it was a nightmare. You didn't have enough people to cover anyone. There was one consultant. If they were off, you had no service. So it was really difficult. And there was a report at the time around the safety around those services, which recommended that they needed to be done on a larger population basis. Okay. So that's the logic around it. And that's why we have that provision. And it is something that we keep under review in terms of the best way to provide services. We've been committed in the last 3 years to working closely in partnership with Cumtaf, which probably wasn't the case prior to that. It was much more of a kind of contractual arrangement. It's now much more of a clinical partnership, and we believe that's been to our benefit. That may or may not continue as that way of organising things, but that was the rationale for it. So it was done with purpose rather than by accident, if you like.
Is Swansea Bay the only trust that's not supplying the services for this area?
We're the only one who doesn't commission a local CAM service, or that doesn't provide a local CAM service. Lots of services are provided for multiple health boards for the more specialist end of things, if you like, which gives benefits, but it also gives disbenefits. So there's pros and cons of both models. Okay,
thank you. Obviously, those are sort of more theoretical than what Mike was talking about. But so, if you'd like to move on, the rest of the.
So COOS, part of our work across the board has been working and developing on the spread of COOS, which is an online facility available for young people, particularly, which is, as you can imagine, plays into a lot of the technology and the smartphone usage that the world revolves around these days. So on the next slide, you'll see that there's some information there around. So basically, it's already in place for Cardiff and Powys and a lot of the UK. This is now being put in place in Swansea Bay. It's targeted particularly at children and young people with well-being or emerging low-level mental health problems in terms of providing support for them and guidance and some ideas about how they can help improve their mental health and support themselves. And it's particularly helpful for some of the hard to reach groups and those who for a variety of reasons, don't want to engage with services through normal routes. So it's an alternative and, you know, another option that's available for our young people. This is, we also have a regional website we've been developing, and this is launching in June as well. And this is about, again, providing some standardized support information. It's been developed with all of the agencies, the voluntary sector, actually trying to identify with young people the kind of things they want to know, the kind of information that they want available to them, and the kind of support they want. And it gives them a bit of a check-in, as you can see there, in terms of how they're feeling. Gives them some suggestions about how they can cope with particular issues they might be facing, and also the kind of support that might be available to them. And that's tailored for the Swansea Bay area, so it's reflecting what's locally available rather than the generality of what might be available, you know, across the country or such like, or nationwide services. So that's again another element of the work that we had in our delivery plan, which what has been a bit delayed because of COVID, but as I say, is coming online shortly. And then in terms of the mapping,
could I just ask, with this website, is there a mechanism for knowing how many participants are on it and what type of issues are they bringing forward?
Yeah, my understanding is that we can definitely monitor the number of hits, as the technology calls it. So the number of hits and who's accessed what on it. So we can use that as a way of identifying those things which appear to be useful to people and those things. And I think there is a comments, like a you know, like people can make comments in relation to various things, or reflect things that they would like to see or that they'd like changed. So we can take that on board.
Thank you.
But you wouldn't have necessarily know the name of the person who's was contacted the service.
No, okay. Because it's not a service response, if you like. It's about people being able to have access to the information available for their local area. Because that was one of the things that was flagged as a gap, was that if people looked for information about what was available to support them, they couldn't actually find it. It was all over the place. It's part about addressing that issue particularly. Okay,
John. Kevin, you got a question?
Yeah, will this be in the form of a link or an app?
It's a web link, is my understanding. Couth is an app. This one is a like a link, or if you got a web search, you'd find it, if you see what I mean.
Thank you.
So in terms of this is a bit of work looking at actually the concerns during COVID, and the issues that people were raising in terms of that, and what we're putting in place to try and support those things. So we've talked about the single point of access and the crisis line around that. Then there's the counselling service and emotional health and wellbeing support, which is targeted at a particular age group. There's the information and the virtual drop-in with the early help attached with that, and the emotional health and wellbeing workers. And I'm sure Gavin will be able to or talk a bit more about that. Educational psychology support, and then at the lower level, pastoral systems being available to keep in touch and highlight any children that are struggling. The resources will be available on a range of websites, so they can be accessed by different, where kids are accessing particular websites, they'll get the link to that further information. And also in terms of the kind of ongoing check-ins within the support in both the school pastoral teams and the education welfare and early help workers. So it's trying to provide that range of support that is available through different mechanisms for different age groups, so that we can try and make sure it's as appropriate as possible for the different age groups. So in terms of the detail about the CAMS performance, and I will, Izzy Davey is here today. Izzy is the clinical lead for Swansea Bay CAMS. So she works for the Cwmtaf Morgannwg Health Board, but she's our local clinical lead for CAMS. And I think it's fair to say, Izzy, we work very closely together in terms of taking these services forward, and would increasingly want to do so. So if I'd been showing this to you a couple of months ago, the performance would have been significantly better. What I would highlight is that the average wait is at 4 weeks for primary CAMS assessment and 5.5 weeks for specialist CAMS assessment. That is a worse position than we have seen earlier in the year. We were adhering to the 80% for both targets for the first time ever for CAMS. I think it's fair to say we've particularly suffered latterly with an increase in referrals and demands, but also in terms of sickness absence and staff transferring. Izzy, I don't know if you want to add anything at that point.
Thanks, Joe. Yeah, it's gutting in a way to be here with you looking at those figures. Certainly pre-COVID and then all through the early part of the first COVID lockdown, as well as getting our single point of access in place. It really gave us an opportunity to ensure that we'd improved our position in terms of waiting times, and for quite a number of months through last year we were 100% for primary and secondary CAMS, and the average wait time was less than a week. But I guess as predicted, sort of coming out of the COVID lockdowns, that the impact of this last year on young people's mental health has been really very significant, and we're really starting to feel that now in terms of the number of referrals coming in across primary and secondary CAMS. And yeah, coupled with that, we're struggling particularly with vacancies particularly in difficulties recruiting and some sickness absence, which is just making it really challenging for everyone in the team at the moment.
And if we go on to the next slide, you'll see there we've got the compliance for the waiting lists in relation to that. So if you look at the top line, the red, I think it's red line, isn't it? Which is a compliance seen within the 28 days. So you can see how that has been very good and has gone down. And my eyesight is not good enough to read what the blue one says, to be honest. I can't, sorry. I think it's got, it's patients, there we go. I can't, so on the version I've got, I can't see it. So the number of patients has gone up, and obviously the compliance has come down around that. And this is a similar picture as in other areas in Wales, although it would be fair to say our compliance was better and stayed better longer than most of the other areas. Most of the other areas, the numbers went up, referrals went up a lot earlier than we've seen. And we're not quite sure why that is, but the pattern is a bit different for us. So as Izzy says, we are struggling with some of the practical reality around that. And, you know, we've obviously got staff who are also exhausted and stressed out because of COVID as well, which is contributing some of the sickness elements. So in terms of referrals, so you've got the position here in terms of the accepted referrals and the redirected referrals. And you'll be aware that we've had issues pretty consistently about if you like, the wrong direction of referrals. And one of the reasons for the having the single point of access is to try and ensure that we don't then kind of go, no, not here, but we actually resolve and put people to the right place for their needs. And that's that sounds simple to do, but is actually a complicated process. And we are committed to ensuring that's happening, but that is very much a process, and one that will take a bit of time to settle down. And I don't know, Izzy, if you want to say any more about that.
Yeah, just I hope it's being noticed on the receiving end. We really tried very hard to, when we took the opportunity at the beginning of the first COVID lockdown to get the single point of access in place. It had been a vision, something we were striving towards for quite some time, and it was really lovely to be able to get that service in place. So we've got two full-time members of staff who provide that service in terms of being there on the end of the phone for advice, support, and they're screening and triaging all the referrals that come in, and we hope providing a better and more helpful response. So where there's little information in a referral, they're able to telephone back to the referrer and to the family to discuss what the difficulties are in more detail, to make sure that the response or the advice is right. We're noticing an increase in demand in that as well. I think we may need additional staff for that service.
In terms of the previous slide, what exactly are you looking for there? You're looking for the yellow bars to be fairly high?
We're looking for the blue bar to be higher, because it means that people are more appropriately directing referrals, we would hope, because it's clearer where they should go. It doesn't mean, in some ways, because we've got the single point of access, there will be an element to which people are likely to tip into that, because that's where they can, if they're not sure, that's where they can get the advice. And I guess for us, it's a trick really about actually how we collect the information to differentiate what's appropriate in terms of coming to the single point of referral versus those things which have been particularly sent to a particular the CAM service, which clearly isn't the case. This used to be a big issue for us. Now that we've got the single point of access, it's less of an issue for us, but it is one of those things that we do get monitored on from an All Wales point of view.
What does a redirected referral mean then exactly?
I'll leave that one to you, Izzy.
I'll come in there. I know, I was interested listening to that conversation actually. Yes, in terms of what this data means, it's changed over time. So a few years ago, that would have been called a rejected referral rather than a redirected referral, and that was bad news for the referrer and the young person, because most usually it was a letter back saying, sorry, you don't meet the criteria, which is incredibly frustrating. Now I hope the redirected referral, the young people and families that are reflected in those numbers have also received something from us in terms of advice and support. So for a lot of those, there will have been telephone contact from the single point of access to discuss what the difficulties are, and agree together whether a service from CAMS or something else is more appropriate. So yeah, whereas in the past the yellow bars were bad news, now I hope both of those, accepted or redirected, represents a young person or family that have received the right help and support, whether it's then directly on to for a CAM service or elsewhere.
So what's the purpose of that graph then?
Well, the purpose of the graph is we have to report on it, to be honest, and therefore it's in the set because of that. I think because we've got a single point of access, which most places haven't got, what we need to do, and this relates to the point that was made earlier, we need to redevelop some of our reporting and our performance measures, because some of them are set at a national level, and because of the way we're organising and our services, they don't tell us what we need to know, which is, as Izzy says, we need to know the number of people who are contacting and what response they're receiving, so that we can monitor and make sure that that's appropriate, and that we haven't got people where we weren't able to respond or give them an alternative because actually it didn't exist, because that will help us map what other services we need to have in place. So I think it's one of those things around, we went very rapidly into implementing the single point of access. Some of the infrastructure around it and the reporting arrangements we need to catch up with and make sure that we're collecting what we need locally to show what we need to know, rather than what Welsh Government is asking us to reflect, which may or may not tell us or give us the right picture.
Because I would have thought what would be interesting now would be to see the number of approaches that have been to the single point of access, so we could compare those numbers against that.
Yeah, no, I think you're right. So, and we can.
That's really helpful. That's what we've been struggling with as a service. So we haven't kept up in terms of the data collection. So at the moment, we haven't got an infrastructure in place to record all the work that's now being done by our single point of access clinicians, because historically we were only able to record accepted referrals, because that was all that was our business. But yeah, so it's be really good going forward for us to be able to evidence around the additional work that's now being done.
And that's partly because the IT system triggers at the point of a referral being accepted. So if you like, that pre-bit to that we've built on doesn't fit into that at the moment. So we'll need to work our way through that, so that preferably, hopefully, that we're not doing a whole manual collection of loads of information.
Is that a standalone system, or are you talking about the new Welsh system?
No, this is a specific CAMS system. It's a health system.
Okay. So something you're developing for yourselves at the moment then?
Well, it's one that's being developed, which is part of the issue, really. And it's not just for us, it's for on a broader footprint. So again, from that point of view. So this shows the position in terms of longest wait and also the waiting list total. And as again, you can see that performance was not so bad until the kind of the last couple of months, where it's accelerated. And then the number of weeks shows the kind of the pattern of how many people are waiting for what periods of time. So you can see that it's reasonably spread, and I know that great efforts are made to try and make sure those longer waits are kept to a minimum.
Sorry, what was the second graph down on that one?
Sorry, the one at the bottom is the number of weeks. So it's the distribution of the number of people waiting how many weeks, if you see what I mean, as opposed to the top one, which shows the longest wait, the median, and the total number on the waiting list.
So we've got about 61 there, of which 13 have been waiting 4 weeks and all that nature then.
Sorry, say that.
There is 6. Well, if you count up above the bars and numbers, you've got 61.
Yeah.
All right. So what you're saying is basically there, 6 was treated almost straight away, 14 within a week.
Yeah.
13 within 4 weeks.
Yeah.
Is that what you're saying? Okay.
Yeah.
Okay. Thank you.
Okay, so I think just to by way of summary, we know that we need to do more in relation to the CAM specialist service, the relationship with schools and social care. We have got additional input into schools and to the local authorities to make sure that from that point of view, and we've used, as you know, the ICF funding for the last 3 years to put in the liaison input into the local authority single point of access teams, and to increase that, in fact. We've also now done a lot of work around actually having tested out, because it was very much a novel approach, that CAMS liaison role in the single point of access teams. Having done that and done some evaluation around that, we've now got a service model for that liaison approach, which has been drafted and is just subject to finishing off. And that's very much about making sure that that's a multi-agency evaluated and agreed model going forward, because we've been able to learn from some of that, and some other areas across Wales are now looking to implement a similar model. And then that will actually mean that the CAM single point of access will accept all inquiries, but that also allows for that dedicated liaison support. So it's kind of, it manages and combines those two components.
Okay.
So just in terms of the challenges that we're facing, obviously we've had recent deterioration in performance, and that's unfortunately followed a period of significant improvement and achievement of the Welsh Government targets for the first time. Demand is definitely increasing, and we are seeing a really significant increase in the demand for eating disorder services. And the modelling that we've done, both locally but based on modelling that's been worked through across the UK, shows that is one of the areas where we would expect to see a significant increase in demand. And we are already experiencing difficulties in terms of children being able to access inpatient eating disorder services. So there is a waiting list to get into T Lydiard, which is the inpatient unit within Wales. There are no beds in the UK available for children with eating disorders currently. There are a dearth of other beds with for children with specialist mental health needs as well. So that is a real concern. So there's a local element of that around provision and support for children with eating disorders, but there's also that highly specialist element, both those ones that we commission from a local basis on a partnership basis, but also those that are commissioned as complex care provision out of area. And you know, but the partnership arrangements that we have in place is absolutely critical to actually making the progress and continuing to make progress. We all know we've got more to do, but I suppose what I try and reflect every time I come and see you is that we're in a better place than the last time I came to see you, and that's not always on a trajectory as positive as I would like. And clearly the last year, 18 months, has been extremely difficult for everyone. And CAM services are no different in relation to that. And CAMS, even though we have combined those teams and improved the facilities that they're working out of and such like, it's still a small team, and it still has recruitment and retention issues around that, and losing a member of staff or having someone off sick. Because the team is relatively small, it can have a disproportionately significant impact, which does mean the stability in the service is always slightly, I was going to say dubious, but that's not probably the way, but slightly unstable. I think as we increase the range of services available and the range of options for children and young people, it also becomes a more attractive place to work. Because professionals don't feel they're working in isolation. They feel more supported and there's more available. So I think that is part of the changes we need to put in place, but that will continue to be a challenge.
I think this is back to Gavin and myself.
Okay.
Sorry, I was trying to work out whether there was another one. No, that's right.
No. So I realised, Joe, that I wasn't keeping up to speed with the slides. So, and we've gone small in the presentation.
Sorry, I just had to turn my microphone back on.
It's all right. I can't read it now.
So it's actually, we're on to the next one as well. Bear with, sorry. That was the end of the CAMS one. So Do you want to cover this one, Julie, or do you want me to?
Yeah, I'm happy for you to, Gav, because you can give some of the detail, and perhaps Helen might be able to chip in as well, where relevant.
Yeah, sure. So what we're leading on to now is, in terms of, we've covered some of the CAM specific updates. So I'm going to give you some updates around some of those updates and progress within Child and Family Service specifically. And then we'll go on a little bit more to education and how we're working together on that as well. So some of the positives have been our joint communication throughout the pandemic. You've heard a little bit about that, about, you know, making sure that we're prioritising keeping in touch and how we stay connected with young people and joining up our communications. Last time we spoke to you a little bit about our emerging emotional health and wellbeing workers. So we now have all 5 workers in post, and they're embedded within a new early help hub structure. So around last March, at the same time, unfortunately, the pandemic was starting to really take hold. We moved into that new early help hub structure. Some of the real positives around that have been developing the partnership approach with CAMS around that whole emotional health and wellbeing offer. So we have one cohesive approach. So we have 5 members of staff that are focusing on the secondary age group. CAMS have 3 members of staff that are focusing on the primary age group. And we also have 1 member of staff embedded in the Youth Justice Service. But all of those members of staff are doing joint group supervision with a specialist CAMS nurse. And we're doing a lot of our group training and development together as well. That's been a real positive there. Obviously, as you would expect, a lot of the work throughout the last year for those staff has been around adapting our provision, making sure that that all of those services are accessible virtually. And at different phases throughout the pandemic, that's shifted slightly between completely virtual and a mix of face-to-face and virtual. And that included as well actually setting up an online drop-in service, so young people, instead of being able to walk directly in somewhere, they could just actually drop in and straight away access a worker as well. So that was a real positive in some of the changes. We also joined up quite a lot with school nursing. So a lot of the school nurses were having to be redeployed during periods of the pandemic for obvious reasons. And we were actually able to redirect a lot of the systems, which was really important at that particular period in time. So referrals coming from hospital would come straight into our IAA team, and they were then actually picked up by our emotional health and wellbeing workers directly. Because of course, with schools not being accessible or the school nurses, it was essential that we were able to identify that gap. You heard a little bit earlier about some of the regional meeting structures, and of course it's important to remember that Health are working with both separate authorities within that, and Neath Talbot do operate slightly differently than we do here in Swansea. So we do have one Swansea specific emotional health and psychological wellbeing group. So we jointly chair that. That's myself and Helen, who are both with you today. And of course, what's really important there is that engagement with our schools. So we have lots of representation from our primary heads. We have the secondary heads there. We have a lot of representation from the third sector and a range of other organisations as well. So that feeds into those regional meeting structures that you heard about earlier. And obviously, that's where we're identifying specifically the kind of issues that we have within Swansea. We're feeding into those developments you've heard about the regional website. We are looking at the monitoring of some of the relevant performance data, so particularly around school counselling, which we commission out to a different organisation. We identify new funding streams, and we've all been trying to work up quite closely together in terms of the development of funding bids in this area. And to try and ensure that there is synergy between how we're developing things in Swansea and that wider regional picture. So I'm going to hand over to Helen, who's joined us as well from education, just to make sure you get a rounded picture of how all of this kind of fits together. And Helen's going to talk to you specifically about some of the areas in education.
Yeah, I've done my best to try and simplify what can be quite a complex picture. I think, you know, just the main bedrock of all of our work is around resilience. And that's what you can see here in the infographic. In education, we work closely with partners in Swansea and local authority, in the Child and Family Services. And obviously, we're working with our colleagues in health to build resilience within our school communities and beyond. So just to give you a little overview of the kind of key strategies that have been introduced in Swansea, not just in response to COVID, but also in response to an increasing demand for mental health services. And just coming back to the earlier point that Joanne Abbott-Davies made, you know, one size does not fit all. So it's really important that schools have the tools to be able to adapt and adjust to their own needs. So just to list some of those key strategies, we have Thrive there. That's a mental health and wellbeing framework that's been introduced in our schools this term to provide them with an opportunity to identify the needs of their pupils and of their whole school community. They can then, with that information, provide targeted support when necessary and to track progress. So it gives them some really useful metrics to be able to evaluate the impact of any intervention. The second strategy there, which is yet to be introduced, but it's important that you're aware of, is ELSA, and that's about improving emotional literacy in our schools so that children, again, are able to identify their emotions and how to manage and regulate themselves. And that would be delivered by an educational psychologist within the next academic year. Gavin's already mentioned the Therapeutic Counselling Service, or TCS, as you can see there. They provide a report to us in EPU, the Emotional Health and Psychological Wellbeing Group. And with that information, we can see, you know, are we meeting the demand? What are the kind of issues that are being raised? And we've seen in the most recent report that there has been a real increase in demand for support around anxiety in response possibly to the pandemic. Gavin's already talked to you about the Early Help Hub, but within education, we obviously have our own specialists that are there to support schools in building their knowledge and understanding and awareness at that lower level, but also that they are able to provide more targeted support as educational psychologists, as learning support team, our education welfare service, etc. So all of those professionals, I think, have really benefited from having the opportunity to talk through cases with the single point of access that we've talked about today, and to make sure that they are being seen by the right people at the right time. And that then, of course, links with that final strand there that you have with CAMS. And I think you've already had quite a bit of detail there from Joanne Abbott-Davies. So yeah, that just gives you an overview of the kind of work that's currently being undertaken in education. Diolch, Gavin.
Okay. Who's coming in now, Gavin or Julie?
Yeah, so I'll just start this bit off, but there's an opportunity then for all the other officers to kind of add to this. It's just a little overview then when you look collectively at that picture, at some of our opportunities. So at the moment, there is quite a strong strategic direction for us. That's come both from some of the emerging work from Welsh Government, which has been useful in that it is quite coherent and gives us a strong direction. We've got, as you've seen, some quite strong partnerships and working relationships developing. And with that strategic direction, there has been significant increases in funding coming through from Welsh Government. And a lot of the projects that you've heard talked about today have been undertaken in a kind of a collaborative way, and we are joining those up. However, of course, then conversely, some of the challenges of that is, as you've heard about, the impact and understanding the needs of our children and young people. In particular, you've heard a lot today about that increasing demand and the challenges that that's presenting. I think one of the other challenges we've found throughout the year is it's very positive to have the funding coming in, but that has often come in when we at very short time scales, and often when we've not been aware how much money would potentially come, and that's made coordinating how we are making sure that all of those funding streams join up quite difficult, especially when we've had some disruption to some of our partnerships. ensuring that all of those services meet need and have synergy together, and that there's no duplication, is always an issue when there's lots of funding coming in. And of course, it's not just the people in the room here today, but there's a lot of funding being channeled into the third sector. So it's also making sure that all of those different organisations, and they're sometimes acting that at a national level, are also tied into the way that things work in Swansea. So that's an ongoing challenge for us. You've heard a little bit today about some of the single points of access, which are starting to help some of ensuring we've got effective pathways. But given that things have changed so rapidly, that certainly does remain a collective challenge, that all of the pathways across those services make sense and are accessible. And obviously that there are no gaps within provision. And as things are changing rapidly, it's really important how we keep up to date and understand the data that we're seeing and are effectively identifying those gaps. And at that point, I'd certainly ask if either Julie or Joe would like to add anything further.
Only to say thank you for everybody's contribution. It's a very comprehensive, I think necessarily so, overview. It's a complex world, and we're working with complex young people, and as somebody said quite rightly earlier, our most vulnerable young people. So thank you for your patience in hearing that, but I think there's some really key messages there for us to share with you in terms of the progress that we've made over the last year, but also we've been quite open and honest about the challenges that we know we face, but we're facing the challenges collectively together. And I know that we have a strong partnership arrangement in place to be able to achieve the necessary progress that we've set ourselves for the coming year.
Okay, thank you, Julie. David, do you want to come in?
Yeah, I couldn't sit quietly and not contribute at all, Chair. First of all, very, very impressive. So thank you. I'll reiterate Julie's comments. Thank you to all the partners that have contributed. I think that's the first time in many years I've seen such a coherent description across the partnership of what we're doing together. I think I've tended to experience that we've done good things, or tried to do good things, but we have tended, I think, particularly in this area, in the area of children's mental health, and I think it probably came up in the scrutiny work that was done previously that Councillor Jones has referred to. Either tended to be a bit scattergun, or one partner would be off trying to do something, and it wasn't coherent with what other partners are doing. And all of us were trying, and all of us were trying to be the best we could be. But overall, it led to an incoherent approach and not serving our children's population to the best they could. In particular, that played out, I think, if we were seeing some of those statistics and having this discussion, only a few years back, I think we'd still have been at a point where we'd be saying, well, specialist CAMS appears to be overwhelmed, but it's overwhelmed a lot of the time with stuff that actually could be more appropriately delivered, and support that should be available to children and young people, via other mechanisms. Well, what we heard today, and I would feel much more confident about, is that continuum of support is much more developed now, much more coherent. It's not done and dusted, and colleagues have been transparent about saying there's still more work to do. And I suppose it left me thinking that if the progress that colleagues have shared today hadn't been made, goodness knows what a pickle we'd have been in if we then layered on top of that the impact of COVID. And COVID is having an impact and will continue to have an impact. But I'd have been really frightened, I think, about how it might have presented today if we were having this discussion and we were seeing the sorts of things we'd seen in the past, and then had services decimated by, through an impact of COVID, workforce decimated, demand increasing, in the way that way that it's hit us, and us being, I think, truly in a pickle and not being able to see the wood for the trees. Whereas I think now we can see the wood for the trees. I took from Certainly the feedback on, the specialist CAMS element of the, of the presentation. Look, we've clearly got demand issues at the moment, not unexpected, and we've heard the context of that. What at least I feel a bit more confident about is we're not going to end up having arguments about that there's a huge amount of demand that isn't actually demand for specialist CAM. So at least it focuses our minds on how do we work with, the health board to be able to make sure we can build some additional resilience into the system, whether that's short term or longer term, as opposed to having to have arguments about, well, is it real demand or not? That definitely feels like progress to me. I suppose one question I had to Chair, just and this probably to Joe or Isabel if they're still on the call. Particularly at a point now where we have got concerns about, we're not hitting the targets. That means there's, additional waiting times, etc. Where we've got an absolute crisis for a young person. I know you talked, Joe, about we've still got a crisis response, but can we be assured, and Kevin, can you give assurance to the panel that irrespective of, we got pressures, workforce pressures, we've got more demand that we can cope with. If we've got a child or young person in critical difficulties, are we able to be assured that we definitely will make sure we've got an urgent response, or can make sure we've got an urgent response for that child and young person, whoever they might be, irrespective of waiting lists or usual pathways or whatever? So if you could just give me and panel that assurance, that would be really helpful.
I'll let Izzy deal to it, but I think Julie and I have been working together the last week or so with exactly that kind of issue, with Izzy's support and others, in terms of an incredibly complex individual and getting a placement sorted. And there aren't any easy answers, but I think we've tried to be open about what's possible and making sure that we've had the right intervention. So I think we can give that assurance, and I'm sure Izzy will want to talk about the fact that we've been very clear as well about if there are any people feel that they are encountering any barriers about getting the kind of response they need in urgent circumstances, then Izzy's details have been made available, as of mine, in terms of accelerating that, so that if there is a pickle brewing, we can do something about it, and that it doesn't get worse. So Izzy, I don't know whether you want to comment on kind of urgent responses.
Yeah, I guess the bit that you picked up on there with the recent complex cases is the bit that's not within our gift is beds, and that's the real crisis point across Wales, across the UK at the moment, is access to beds, because the demand has just increased so much in terms of young people presenting with really, really complex and severe mental illness. In terms of a first response locally from CAMS, absolutely, I can give you that assurance. That's partly because obviously we're doing everything we can to ensure that we're triaging and clinically prioritising appropriately, but also interestingly in terms of our workforce, and this is an issue for us moving forward in terms of how we're configuring our service, where we've made changes to develop things like the single point of access and develop our crisis team, who work 7 days a week, 12 hours a day. Those parts and some of the other bits of those specific and specialist parts of service are relatively more attractive to staff, so we don't have the problems in staffing in those teams. So our crisis team of 6-7 nurses is fully staffed, and so that support is there in responding to urgent referrals from GPs, from emergency department, from paediatric wards for young people presenting in crisis. Our gaps are in the core part of the team, and the part of the team providing the ongoing longer term therapeutic intervention. That's where our challenge is, but absolutely in terms of the urgent response to young people in crisis, that support is absolutely there.
No, thank you both. Thanks, Chair.
Can I just say then, on that basis, to everybody who's presented, Thank you very much for the presentation. It has been obviously very interesting, and I know Mary will have listened very interestedly as well. But the sort of feedback I was getting out of that, and you tell me if I'm wrong, is that good progress was being made in terms of CAMS, but COVID came along and has knocked that progress sideways, and it's something that you need to be recovering. And also because of COVID itself, as you've seen a greater incidence in mental health problems arising within young children and young people, and you're struggling to meet that demand with the resources that you've got at the moment. On the positive side, from what I was hearing, there is funding coming through, which might help you in that respect. And there is plenty of money in the system as far as Welsh Government is concerned, as far as I'm concerned, but I've said that before and I'm not going to go down that route. And also really the importance of the teamwork that's going on as well, and bringing people together and we're working as a team, so you're not a split system is important. We will be looking forward very closely to information coming back, and I think we will be wanting to have information coming back on a fairly regular basis for a while until we see where we go with this. Anyway, thank you very much to everybody who's presented, and I appreciate that. Mary, you wanted to say something?
If you don't mind, Chair, I'd just like to congratulate everybody. When I see the start of the journey into where we are now, there has been remarkable progress, even without COVID, and you have had some really tough months gone by. But we wanted the first point of contact, which you've done. You've managed to get more staff in place and all the joint working. And really, it's such a huge jump, I think, from when we looked at the last time, even with COVID intervening. I think everybody's worked exceptionally hard. And yes, thank you. From what we started out with, that nobody knew what CAMS was. There was nothing. Youth Justice didn't have a say in the matter. They seemed to be sidelined, and health and social care, not blaming anybody, you just didn't have the money or any of the resources to get to the point you are now. But it is coming, together, and I think our young people are being very well served. So let's hope the next update is as positive as the one we've had now. Thank you.
I'm certainly not going to argue with any of that, Mary, that's for sure. And the only thing I'll add, of course, is that we are going on to talk about the youth justice system. And obviously the work that you do will impact on that itself and the service that they have to provide. I must apologise to them that I've let this session go on a little bit longer than perhaps I should, which means they're going to have less time. But I will apologise to Jay McCabe and Helen Williams for that when I start off. But it has been important. It's set the scene also for that as well. And all I can say again is thank you very much for the presentation. We understand all the hard work that is going in, and we wish you well with it. Thank you.
Thank you.
On that basis, I will move on to the next item on the agenda, which is item 8, and that is the Youth Justice Service Progress Report, because obviously this was another service which had a problem in itself. I'm sorry, as I say, to Jay and Helen, that I let the last system go on a little bit longer, perhaps, than I should have. And I hope we'll be able to do you justice in that sense, because obviously we need to finish by about 6 o'clock. But we can always come back again if we need to, and I'm sure we will anyway. So my apologies, first of all, for giving you a bit shorter time, but over to you. Thank you.
Thank you, Chair. Firstly, to also say good afternoon, good evening to everybody, and thank you for giving us the chance to provide the update report. I think, if I remember rightly, we're sort of a year down the line, I think, in terms of when we last presented this, and I think it was just before COVID. So what I'm going to do, if it's okay with everybody, I will provide a bit of an overview in terms of the update report. I'll share this with you in a minute. And then obviously when we get to the end of the section, there's a chance. I wanted to include Helen in the discussion because she'll be able to offer some valuable contributions. So it'll be a chance for you to ask us both some questions jointly, if that's okay with everybody.
Yeah, that's fine.
Is that okay?
Yes, that's fine.
Bear with me. I'll pull up the report for you now. This is the bit where I have to do the technical part, so just bear with me. Okay, I'm definitely showing the wrong document. Can you see that?
Yes.
Yeah, has it come through?
Yes.
Fantastic. Okay, I'm obviously very conscious that there may or may not be new members in Scrutiny today, so I will just very briefly just sort of summarise the fact that in 2019, April 2019, Swansea disaggregated and formulated its own youth justice service. And since that point, we've been on a very slow and steady improvement journey. I'm pleased to report that it has been a steady and positive improvement. I don't want to sort of jump ahead and sort of anticipate that we're there yet. We've still got quite a way to go, but I just wanted to share with everybody that we are making slow and steady progress. As I just go through very quickly, what you'll see under 1.3 is just that I've included in the appendix a copy of the most recently reviewed Improvement and Action Plan. What I just wanted to assure everybody is that myself and Helen review this action plan on a 6-monthly basis, just to ensure that we're continuing to comply with the recommendations, but obviously to identify any additional areas of improvement. But it's just to assure everybody it's a very large document, so rather than taking you through that, obviously you may want to have a look at that in your own time, but it was really just for your reference purposes so that you could see that the work is ongoing, that all the areas that we initially identified in terms of areas for improvement have been signed off, and we've either engaged or completed in that work. But obviously just to reassure you that we continue to review that. The other key thing to share with Scrutiny is that obviously as part of our yearly work, myself and Helen have to devise a youth justice plan. We're just in the process of developing the new one for this particular year, and then that will be submitted to the Youth Justice Board in June, at which point obviously all members of the Youth Justice Board will have a chance to review that with us. But we work with all of our partners to develop this, so everybody's involved in the formation of the plan. But I just wanted to let you know we're on target to get that completed on time. Okay, the next bit that I just wanted to talk you through, if it's important, is just around specifics around financial information. The key thing to sort of share with you, in my last report, I think at the time I was in the process of advertising or securing an operational manager, and obviously the exciting part to share with you is that Helen is now in post, and obviously she's here in the meeting, which is fantastic. And we also are in the process of recruiting a senior practitioner within the service. The great news is that role has developed, and since that time we've developed the role, and it's now become a practice lead role, which is specifically focused around safeguarding, but actually it's about supporting the team in order to bring all of the service in line with safeguarding. So it's not just that role, it's about driving that practice forward. The other key things to sort of share with you is that we had talked about ensuring that everyone within the service was Asset Plus trained. My understanding, and Helen, please correct me if I'm wrong, we have a couple of members of staff who have yet to receive the training, but these are members of staff who have very either recently joined the service, so are new members of staff, or some of them will be prevention staff. So what we wanted to do was encourage all of the staff at all levels of the service to be trained up to be able to carry out this assessment process. And the primary thinking is we wanted to ensure that everybody was using exactly the same system. So it's really about upskilling the staff. And my understanding, and obviously Helen might come back to me on this one, but I'm confident that, that this is obviously benefiting everybody. And what it's really designed to do is increase the level of resilience within the service, but also ensure that everybody is carrying out the same assessment processes. So it's really about bringing everything in line. The other thing to share with you, obviously, we're part of a much larger national working group, so we're part of YOS Managers Cymru, and recently we received some additional funding that was redistributed back to the South Wales group, and this has meant that we've been able to consider investing this money in training up some specific staff within the Youth Justice Service to complete some work around sexualised risk. There's a particular training course called AIM 3, and what Helen and I hope to do is train up some specific staff so we can offer the sexualised risk assessment and interventions to children and obviously young people across child and family services. So we're looking to develop that particular part of the service, but obviously the benefit for us is it's not at any extra cost to us because we've already got the funding in place. So as I've already alluded to, we're obviously increasing people's assessment capacity, which is a real positive. The next bit that I just wanted to cover, or just make sure that you're aware again, just to continue to reassure you, We are in the process of finalising the mobilisation of the regional speech and language service. It's something we've been working towards for quite a long time. I'm really excited about this service and can't wait to get it online. But obviously, just to sort of let you know, what we did was we maximised some of the grant funding that we had from the Children and Communities grant, and the specific piece of grant funding that comes under that is the Promoting Positive Engagement grant, which is sort of diverted to youth justice. What we've managed to do is access a little bit more of that, so it means the regional speech and language service will be funded through that grant funding. So it's very exciting, and the service will come online in July.
Can I ask a question quickly?
Of course you can. Of course you can.
What exactly do you mean by the? I'm looking for the term now. Speech and language service.
Okay, so speech and language services provide a very specialist assessment for young people who may have communication or speech and language difficulties. And what we know historically and through research is that a number of young people, usually within the criminal justice system, may potentially have delays through learning difficulties, speech and language difficulties. So this primary purpose is to try and support young people. It's also to help provide a plan for the young person, communication plan. I'm sure there'll be another range of other interventions. It might be tools to help support the young person to learn and develop, but the idea is primarily to support that young person so that we can continue to support them, but also offer the interventions primarily at the right stage, but also using the right communication means in order to help them, because I'm sure you may be aware some of them may struggle to understand some of the things that are expected of them. The idea is it's really hopefully going to help a lot of young people who are experiencing difficulties. Helen, did you want to add anything to that?
Sorry, I'm actually fighting with my cat at this moment. No, nothing at all. No, I think what you're saying, Jay, is absolutely correct. And it's just about ensuring that when we have young people within our system, which is a really complex system, when we talk about youth justice, there's a lot of processes and expectations on young people subject to orders. So it is really important that we understand how best to work with those individuals. And I think this is, I'm really excited about this service beginning in July, because I think it will provide us that opportunity to ensure that the way in which we're communicating with our young people and the way in which we're helping their understanding will be correct.
So what you're saying is an effective communication system?
Yes.
Yeah.
Thank you.
I appreciate you asking the question, and also just to sort of share with you, this is definitely a service that my understanding is that Welsh Government are very keen to promote across youth justice services, and obviously we've been working hard to try and secure this. It will be reviewed on an annual basis, so we will obviously be looking to see how effective this service is, and more than happy to report back to Scrutiny to let them know how this is progressing, but obviously we'll be reviewing this on a regular basis. Okay, the next step is, or just to sort of share with you, just some small positives. We've obviously continued to secure ongoing grant funding. As you may or may not be aware, the Youth Justice Services is made up of a number of different pots of grant funded money. We obviously do our very best to maximise that. And obviously the good news this year is we had a small uplift from the YJB. I think it was about £30,000. It just means that it'll enable us to use that and invest in some service improvements effectively. So I just wanted to share that with you and to confirm that we've continued to secure funding. The other things that I just wanted to share with you, I hope it's okay, but I wanted to just give you an overview of some of the key bits of improvement over the last year so that you've got a bit of an overview. So the most important thing, and obviously very pleased to report to you that the service has consistently ensured that assessments are being completed in timescale. I'm sure some of you who were part of the original meeting we met last time will be aware that that was a big focus for us. And what we wanted to do was focus on timescales and quality. So the timescales are definitely being achieved now, which is fantastic. But obviously the next stage for us is to continue to focus on improving the quality of our assessments, reports and plans. What you'll see is obviously that will be referred to in the appendix for the case studies, but obviously we can talk about that in a little bit. The other key thing that was identified was about supervisions being done in a timely manner and everybody getting supervision. Again, I'm pleased to report to you that that is happening consistently and that the staff are being supported by the correct individuals. And obviously part of the process is we really want to focus on developing and improving staff's confidence. The other key thing is that our policies and procedures are now up to date, reviewed and in place. And I'm sure, you know, Dave, Julie and Joe and Gavin will probably attest to the fact that they are part of the board and they have to experience us running through all of these documents with them on a regular basis. So obviously they've been part of that process. We're continuing to develop strong relationships with our education colleagues. I mean, one of the key things to share with you is we've recently developed the literacy and numeracy policy. The framework is absolutely huge. We managed to bring it down into something far more manageable at a local level. Another thing I'd like to share with you is that I sit on the Hard to Place operational panel, and Helen Howells will probably be able to confirm that. We work very closely with our education partners to look at the needs specifically of some of the most complicated young people to try and see if we can identify ways to remove barriers. The other exciting part to share with you is we've recently had a part-time CAMHS nurse appointed in post. She started in March, which I'm very excited about because that's going to help improve the pathway, particularly for these particularly young people. So that's really exciting. Ultimately, the part is that we're focusing on an improvement journey around quality, which I'm sure Helen may want to add to. A lot of the work that Helen's focusing on right now is that it really is ultimately about improving the quality of plans, assessments and interventions. And I'll come to a little bit in a minute about what we're doing next in relation to that. The other really positive thing to share with you then is about the National Standards Audit. So we pulled the whole service together and board members to develop an action plan to the National Standards Audit. And what I would like to report back to everybody is that the YJB were very pleased with this piece of work and gave us some good feedback. And as a result of that, they haven't asked to come back and have a look at that in more detail, whereas other youth justice services, they have wanted to do that. So it's just to share with you, we've given them that assurance. In terms of moving forward, as I've said to you, I did sort of say, actually, we thought we'd mobilise it by April. I do apologise. The date recently shifted. It was July. One of the other key pieces of work that we're moving towards is transferring all of our grade 7 staff, obviously, onto the Asset Plus system to ensure that everybody is using exactly the same system. So obviously, we have staff that work within a prevention capacity. And what we want to ensure is that staff are assessing using the correct system to be able to do that. Previously, the service was using a screening tool, which was a very, what I would refer to as a lighter method, but actually for me didn't provide the degree of robustness that we wanted. So Helen and I jointly agreed that we wanted everybody on the same system. The other thing then to share is that the grade 7 staff will all be moving over to a standardised job description. And this is about building a much broader range of skills across the workforce, but we've also applied that same approach with the social workers as well. So previously and prior to my time, we had lots of specialisms within the service. We haven't lost those specialisms because obviously people still have that specialist knowledge, but what we have done is broaden people's skill base out so that everybody can respond and provide assessments in a number of different areas. So it's really about building resilience within the service. The other part that I just referred to a little bit earlier that Helen and I have been working on is about the development of a quality assurance framework and an audit plan. And one of Helen's key objectives has been about getting an audit plan up and running. We will be taking that audit plan to the next board meeting in June, and we're very excited to be saying that we've actually identified a timetable of auditing that we're going to be working towards. I'm very pleased to share that as well. I'm just trying to think in terms of anything else. I've already covered the staffing component, discussed the appointment of the roles. And I think other than that, that's everything covered in terms of my update report for everybody. Before we move on to any of the case study stuff, I just wanted to give you the chance to ask any questions.
Does anybody have any questions? I think you're doing all right at the moment. Jay, carry on.
Thank you, sir. Thank you. The other thing I just wanted to share with you, and I wasn't sure whether to share it at the end or before, but what was also really lovely to sort of get some feedback from, and Helen and I are, you know, obviously delighted with the news that YJB are updated us, and you will have seen it in the pack. They provided a letter of de-escalation, which effectively is saying that they're satisfied at this point in time that we're working towards the improvements that we said we were going to, and that we're in the right direction. As I've said to you earlier, I don't want to assume that we're on the right path pathway. Helen and I are always consciously trying to make sure that we're reviewing things continuously. And I think we're always cautiously optimistic, if that's the right word to use. So we're always working on that basis. But obviously what we want to just assure everybody is that we are continually focusing on that improvement journey. It's a fundamental part for us. But I mean, the key thing is, if you'd like to, and I just thought it might be a chance for you to look at the case studies. So Chair, just for your information, it was one of the actions that you asked us to take forward from the last meeting. You did ask if members could have access to some example case studies, just for you to have a look at, so it could make it a little bit more real for you in terms of what the service does. I don't know if members of the group have had a chance to have a little look at that. But if you'd like to have a look at that, but really it's just an opportunity now for you to talk to myself and Helen about anything you'd like to ask us. The case studies were just for your benefits, that you could see them.
Anybody? Obviously no comments at this stage. I think we were looking and wondering if we were going to talk about the performance reporting.
I mean, Helen's here. I mean, she's discussed the performance report before, but I mean, Helen, are you happy to share sort of the feedback that you gave to the board regarding the last performance report? I mean, Helen normally does a really helpful section as a manager's summary at the end. If you're happy to just give an overview, Helen, is that okay?
I certainly can. Do you need to share it, Jay?
Yeah. Do you want me to? I'll share it. No
yeah.
problem.
Sorry. Do you mind? I'm not
at all.
for that bit at the minute. I wasn't expecting to do.
It's my fault. I'll put you on the spot there. I do apologise.
It's okay. It's okay. I'm just going to try and get it up on my screen as well.
Bear with me. I think I might have it, Helen. Bear with me.
Fabulous. Thank you.
Can everybody see this?
Yes.
Okay.
Yes, indeed.
Helen,
I'll go to the very end section because that's usually the most helpful, isn't it?
That would be very helpful. Thank you. Thanks, Joe.
Let me see if I can make it bigger. Bear with me. That's better.
Fab. Okay, so it's, as I'm sure you've all seen, it's quite a lengthy report. So rather than go into all of it, I generally just pick out the highlights, really, just to kind of give an overview. So obviously feel free to ask any questions at the end if there's anything additional that you would like to know. I think some of this actually Jay has already touched on, to be honest, because one of the things that the management board, quite rightly, have been scrutinising us on is around our assessments and whether we are achieving those and completing those within the timeframes and in terms of quality of those assessments. And within the last quarter, we actually had quite a significant number, an increase, I should say, in terms of the number of assessments that had come through to the service compared to the previous quarters. And you know, that might be to do with some of the relaxations with COVID and just some of those opportunities, young people being processed maybe through the system. But for whatever the reasons were, we had a number of assessments and we managed to complete all of them within time frame, which I think is, you know, it's really it really is a celebration of success and evidences the improvement within the service and the dedication of staff really working on that area and making every effort to complete that, really. We've been looking at transitions. So in terms of working with young people who are approaching 18, looking at how we support them in terms of their transition into the adult process. So obviously our hope would be that we would continue to work with young people as youths and they wouldn't necessarily go into the adult process, that we would be able to undertake that work. But being realistic, sometimes young people might have orders that take them over their 18th birthday and also may offend when they're 17. And we obviously have to consider how we support them through that process. So the youth to adult transition process is something that we have been working on with our probation officer that's seconded into our service, who's obviously got the knowledge of the probation service and how probation work. And it's really enabling us to embed and to think about how we use that transition effectively. I've also been working with colleagues within probation and within Neath Talbot Youth Justice Service to look at a youth to adult policy, so local policy that ensures that we're following a clear process, and that young people have a plan that they work with from the age of sort of 17 and 6 months right the way through to beyond any transition into probation. So that is a fairly recent policy. Again, that hasn't yet been shared with the board, but it will be at our next board meeting for that ratification. But we have started to embed some of those principles and those processes already, and have had some success with a couple of young people that have been part of that process. In terms of prevention, the quarter for which this report was written, there was an increase in our prevention referrals. Again, we believe that that might have been due to restrictions being lifted, schools returning, that we were actually seeing some of those referrals coming through a little bit more to our norm, I guess, pre-COVID, and what that might have looked like. Within this, we sort of we're thinking about trends and themes, and we have been seeing certainly during that quarter that there were referrals coming through for young people where there was sort of worries maybe around violence within the home and potential concerns around domestic abuse. So we've been doing some work around our interventions, thinking about the kind of work that we are undertaking with those young people to ensure that we are addressing those needs effectively. We've had a group of staff looking at our current interventions. We recognise that in terms of the work that we're undertaking with young people, and in terms of I guess the kind of I want to use the word culture, it's probably not the right word, but in terms of what we're seeing with young people around criminal exploitation and county lines, and some of those things that we're noticing our young people are presenting when they're coming through to us, we are recognising that interventions is an area of work that we do need to develop, and it is certainly something that we are looking at to ensure that staff are appropriately trained and feel confident to be able to manage those presenting issues. We've been looking at for quite some time issues around sort of violent offending. We've had a number of, we sort of break this down within all of our performance reports, and we recognise that violence against the person is an offence type that we see quite regularly. And we are continuing to do some work. I mean, Jay mentioned the audit plan a little bit earlier, and part of that is about us having the opportunity to look at cases and really unpick the work that we're doing, where there may be gaps in terms of our interventions and what we can add to, but also what we can learn from working with these particular young people, and also how we work with some of our partners, like St Giles Trust, just to ensure that we're getting some specialist support in for young people as and when that's required. Participation is also an area that we have been working on. Sorry, Jay, I'm looking at it on a different screen, my apologies. Yeah, so we're looking at participation and just in terms of how we are ensuring that our young people's voices are being heard and that we're learning from the feedback that they're providing. So within the last couple of board meetings, we've been looking at we're working through our national standards, and we've looked at a couple of our national standards, one relating to work that we've undertaken in court, and in relation to work that we're undertaking with young people on community orders. And for both of those presentations, we have been able to speak to some of our young people and ensure that their voices are quite literally heard in our board meetings, because we've been able to record their responses and, with their consent, share that with our partner agencies and our board members. And it certainly enables us to really reflect on the work that we're doing and actually where we can improve. So I think one message, very clear message that we had from one young person when we were talking about court, is the importance of the case manager being in attendance at court when a young person is being sentenced. So we always have court officers and we always have staff available to support. But there was just something in that message for me in terms of having the case manager to be there to support somebody that they know and they've got a good relationship with. So, you know, we're taking those things on board and ensuring that we are doing what is in best practice for our young people. And COVID comes up quite a lot, and I know that it's been discussed quite a bit within this arena, but we've obviously talked about it in our board meetings, but as a service as a whole, and it as with any other service, it's had an impact on us. There's no doubt about that. We've had to change our way of working. We're all working from home as every other service, and we've considered sort of the impact of that on staff. And staff have, over the last 12 months, they have struggled, and we've definitely seen sort of periods of time where our staff are feeling confident and it's okay, but also periods of time where emotional well-being may have been dipping slightly. And certainly what staff are telling us is that they're finding it really difficult to be separate all of the time and to not have those kind of opportunities to be together, to have those ad hoc conversations, and to provide that support to one another they would naturally have in an office environment. The reflections are also in respect of how we're working with young people. So previously, pre-COVID, we would have had young people coming into our Youth Justice Centre quite regularly, and staff would have been very much engaged with them on a daily basis. We've obviously had to change that way of working. But staff have been really creative, they've been fantastic and have responded really well. So we're seeing young people in the community where it's safe to do so. We have more recently had young people attending the Youth Justice Centre for those young people that have really needed that sort of intensive level of work or have required an appropriate space to have some of those more sensitive or difficult conversations. And we have been able to do that because of some of the releases in restrictions, and we're able to do that safely. One of the things that at the time of this report was an issue for us was around restorative conferencing and actually having the opportunities to sit with young people and victims who are willing to take part in those processes. Really, really valuable processes. It really makes a difference in terms of our young people's understanding of the impact of their behaviour and the impact on other people. But we've really struggled through COVID because we haven't been able to undertake safely those meetings in a safe space together. It hasn't really been appropriate to consider doing those in the way that we are having a conversation now online, just because of the nature of those sensitive conversations, really. But I'm really pleased now that we are in a position where we are safely able to have small groups of people within the Youth Justice Centre, which has enabled us to open that up a little bit. And we have had a couple recently, actually, of conferences that have been really impactful and really, really positive in terms of how young people have been able to understand and how victims have felt that they've had the opportunity to have their say, know that they've been heard, and really understand the plan and the process for young people moving forward. I think that's probably it. Jay, is there anything that I've missed?
There were just a couple of things actually, and I hope you don't mind. I will say this really, really quickly. Just to assure everybody, we're heavily involved in the contextual safeguarding processes. Helen and I both attend all of the CMET meetings, and I chair some of the CMET meetings. So it's a really good opportunity for us to be heavily linked in. And I'm also part of a working group at the moment with Bedfordshire University to try and look at how youth justice services can be more integrated into the contextual way of working. So very excited to take that bit forward. The other thing to sort of share with you, and as a result of that, Helen and I are very, very much influencing and part of, we're developing a serious violence strategy as well, because we recognise the current climate within Swansea, particularly for a number of young people. And what we're trying to do is get ahead of the process. And we've had some great feedback from the Violence Prevention Unit to say that actually, as an authority, we're responding ahead of potential central government guidance. So it's really exciting to know that we're actually following the right trend, if that makes sense. And the other thing, Helen, I just wanted to sort of say, and just to share with everybody, Helen has worked really hard, and she needs to take some of the credit really for the amount of work that she's been putting in to try and support the culture in the team, because we've had some staff members who've moved on to different things now. But I think what I was going to say is it's been challenging for some members of staff, hasn't it? But I think we've supported them to sort of go on to the next stage of their journey and in the right place now. But that's it. I'm not going to say any more because what I've done is just talk at you.
David or Julie, want to add anything?
Thanks, Chair. I think I think Helen and Joe were a little modest about the significance of the achievement of the letter from the Youth Justice Board. So
Yep.
It is significant for us as a service, and I think we've made fantastic progress over the last year, and I think it's down to their great leadership and management of the team and being open and honest about expectations. And we can really see the difference in the service, and we can see quite clearly how the improvement plan will continue to be implemented. And it's absolutely great to hear feedback from young people at the Youth Justice Board, because that really does bring it alive in more ways than one. And I think this is another example of where we are doing really well at partnership working with young people, but also with other agencies, and you can see that and feel that at the board meetings. So there are endless opportunities for us to continue to, I think, trailblaze in Swansea and showcase good practice. But also we continue to learn, and I think it's right to be cautiously optimistic, but at the same time it is right to be optimistic. So well done, both of you.
Okay, thanks, Julie. David, you got your hand up?
Yeah, just to endorse the feedback that Julie's given there, Chair. I chair the management board. I don't think we could have had a more disastrous or damning inspection than the one that we had that preceded Swansea bringing the service back locally. Fully endorse Julie's comments about the leadership that both Jay and Helen have demonstrated over the period. The board is a functioning board. That's not down to me, but that is down to the partnership commitment that's been very evident. I've been really reassured and pleased that each of the statutory partners have accepted and are committed to recognising that we can't be anything other than significantly letting down our children and young people in this area if we're not all committed together to make the improvements that need to be made. And each of the partners have stepped up to that, and I thank them for their commitment to that. It is right to take a position of humility around, yes, we're cautiously optimistic, but the evidence of improvement that we are seeing in the board, that's evidence from the performance report, there's evidence from the feedback that we're getting from other stakeholders, like that very important feedback from Youth Justice Board. But the reality is, I, like Julie, am optimistic that actually when the inspectors come, I'm sure they'll identify things where they say there's further improvement that you can make, but there is lots that they will find about not just addressing, the concerns that were highlighted previously, but around the innovation and improvement that Helen, Jay and their team have driven forward. So I think at this stage, Chair, and subject to that inspection that we are anticipating at some stage in the near future, I think the panel can take assurance that considerable improvements been made.
Thank you, David. Any members got any questions for Jay or Helen?
Can I just say something, Chair? I'm only speaking because you had a tone of voice there that said Mike's bound to say something because he hadn't spoken for the last 48 minutes.
That's very
can I just say, it's fantastic, as Julie alluded to there, to see at the back of the paper the letter from Miss or Mrs. De Freitas from the Youth Justice Board. This is powerful. I mean, in Swansea for a long time, we were all very proud of the Youth Justice service and what a great job it had done under Eddie Isles all those years ago. To see it degenerate when we had regional was a bit tragic, and to see it recover so dramatically in what is not a very long time under very unusual circumstances is a breath of fresh air, and hats off to all of you. Complacency, of course, is the enemy within, but it's not present here, clearly. So well done, everybody. Can I just ask Jay particularly, this idea of specialisms with broader skills base? One of the things that gets me, Dave Howes knows this, sorry for saying this, Dave, we got too many acronyms, too many teams. Some people are co-funded, solid, funded by City and County of Swansea. We got other people that we catch when the Welsh Government rains these different grants down upon us. So is the result then having people pulling against each other? Do we have this disjointed approach to delivering services, not adding synergy and togetherness, but having the effect of spreading skills more widely rather than bringing people together? So I like that idea, Jay, of specialism with the broader skills base. So don't tell us that there's not enough in the last presentation, enough people working in child and adolescent mental health. We're all in it together. It's developing those skills across education, social services, and policing, the fire service, and the wider public service as wide as possible. Sorry, I'm going on now, and it is too late.
Sue?
Just really to say it's great to hear the management is coping so well, and that you are caring for the staff who have come through an awful time, and that really heartens us because they are our best asset.
Thank you. Okay, thank you. Erica?
I'll be really brief, but I just want to champion what I've heard and feel very heartwarmed that we're doing our best. What's concerning me is with young people and what happened over the weekend in May Hill with a lot of young people. The word culture is coming up all the time about this mentality they're developing. And I was just wondering if you incorporate that, because individually they're all fabulous, they're great, but it's this collective attitude that I think we are concerned about. I'm sorry to bring it in so late, but it's on everybody's minds right now, I think. Thank you.
You want to say something to that, Jay?
Yes, please, if that's okay. And Erica, I really appreciate you raising that. I think sort of just to share with you a really positive example. So on Friday, we made the decision to arrange an extraordinary CMET meeting. And what I can definitely report to you is that there were 50 agencies present in that meeting. It was a really lovely example of partnership working at its best. I mean, it was a hell of a meeting to try and chair, but it was a really, really good meeting. And we pulled together a range of partners, education. We had Child and Family Services, police, the fire service. There are a whole range of partners. But I just wanted to say to you how pleased I was to see that it was such a coordinated response. Everybody was focused on how we could try and address a number of different issues. So we talked about the community, we talked about children and young people, we talked about staff, we talked about the impact in the wider community. I mean, I think we literally covered absolutely everything. But I just want to assure you, Erica, one of the things that's firmly on my mind, and that was the reason why Helen and I have been working on the serious violence strategies, because we're aware of issues such as this. And what we want to do is to get ahead of the game and actually start identifying where the problems are, what are the issues, and what can we do differently to start intervening. Does that answer your question?
Yeah, thank you so much. And it's a big thing ahead of you. But I think with people like yourselves working on this, we will come to some sort of, I don't know, we can't maybe not get rid of it, but certainly change young people's minds about life in general. So thank you so much. Thank you.
Helen, do you want to come back in on that?
Yeah, I'm just going to say, if you don't mind, just one little thing to add, really. It's just to say that we're also, because I think you're right in terms of culture, and it is something that we are concerned about and thinking about in terms of how we're able to get messages to young people and to support them as best we can. So we're also involved in, again, working in partnership with our colleagues across Child and Family and many other agencies to try and get messages out as soon as we possibly can. So we're looking at outreach works. We've been involved in some of that. Just getting out there on a Friday evening, Saturday to try and speak to young people and engage with them. But we're also working on a project of within schools. So we've already completed that within one comprehensive school. It's ongoing, and we're looking to spread that out across schools just to try and support and get those messages out and get people to know the staff, the staff within my team as well as other teams. So maybe they're a little bit more willing to have those open conversations.
Okay, thank you, Helen. Cyril?
Yeah, thank you, Chair. Going on what Erica asked there, that was part of my question. But in a meeting on Friday, it was so sad, but thing come out of the police officer, senior police officer's mouth is these vigils. Now, it's great to go and have the youngsters remember somebody, but what's tend to be coming out over COVID is the violence that's coming on with them. I'm wondering if you've seen that in your work, and I do also what Julie and Dave says, looking at where you were 12 months ago, you've come on in leaps and bounds. But I'm wondering if would you have the chance of working with these youngsters to, to see about how these vigils are going overboard?
Okay, thanks.
Do you want to respond, Helen, or shall I?
It's difficult to know on the screen, isn't it? So, but yeah, I mean, I understand exactly what your comments are about, and I think, obviously last week it got, there's no denying it got completely out of hand, and it did become a very significant and very serious issue, actually. I mean, it's difficult to say with vigils because thankfully that's not something that we are seeing regularly, thank goodness, isn't it? Obviously, it's a very tragic incident with a young lad last week, and I think there probably was some emotion. I mean, what I'm not clear about at this moment in time, and I'm sure the clarity will come over the sort of next week and coming weeks, really, is the connection between that vigil and what happened. I know that that's certainly being reported, and absolutely young people gathered for that purpose, but I'm not sure whether there were maybe more things going on within the community. I don't know, and I suppose it's difficult to comment on that. But what I can comment on is the issues around the violence, because I think that's absolutely a valid point. And as Jay's mentioned earlier, we are looking at that across Swansea with all of our partners, thinking about what is actually happening in terms of youth violence at this moment in time within the Swansea area, and how do we collectively respond to that. As a service, we work one-to-one with young people, so any young people that come through, whether that is because they're on a court order or whether it's on a prevention level, we obviously have those clear discussions with young people and support their thinking in terms of their behaviour and violence and how they could potentially deal with issues slightly differently. We use our emotional health worker significantly in those issues to look at anger and how young people can manage that better. But it's definitely something that is going to require us to continue to think about and continue to plan and continue to understand, really. Jay, I don't know whether there's anything you want to add to that, but
No. I mean, I think the key bit is just to sort of make you aware we're definitely using CMAT as an opportunity to innovate some ideas, and some of the things we've talked about is even looking at how we could potentially develop a social enterprise with young people to help them reclaim responsibility for the local community and be proud of that area. And what we want to do is sort of disrupt it, but then also offer some suitable alternatives. It's just a really sad shame because I don't think anybody would have anticipated the events on Friday, what sort of caused it and how it's escalated. And we've tried our best in the meeting to sort of explore whether there were other factors such as alcohol or substance misuse. But I think it's been really difficult to determine, and hopefully, we've got regular review meetings happening. We're hoping that the police may have some further intelligence as time goes by to sort of understand what might have triggered it. But I think at this moment we're none the wiser. But what we definitely have noticed, I mean, since the event on Friday, there hasn't been any further instances. They were planning on having further vigils, but that has ceased since. But I think it's then just sort of trying to sort of have some conversations with young people. And I think what we've already identified is having a bit more of a presence in the community is going to make a big difference, and just hearing what's going on in the ground.
Yeah, thank you, Jay, Ellen. But can I just reiterate, I would like to thank all the services out there over that night and up to this present day for all the bloody hard work that they've been doing to help the community, and the community have helped themselves as well. And I think Erica will back me up on that. They have come together, and it's good to see our services coming together and working together. Thank you very much.
Okay. Let me at this point say then thank you very much to Jay and Helen. Obviously, the very fact of the letter you had says an awful lot in terms of where you've come over a fairly short period of time, and that is really credit to the department, and we will look to make sure to hope that you will continue to make that improvement going forward. Obviously, the situation happening in Mayhill is a separate issue and is something that needs to be looked at separately, and I can understand why it's been brought up here. But in essence, as far as the report that we got there, major progress has been made. We much appreciate it, and thank you very much for your presentation today. Thank you.
Thank you, everybody. Thanks for your time.
Thank you.
Bye.
Thanks, everyone.
Finally, before we finish, just very quickly in terms of the work programme, we have, or at least I should say, when I say we, I should say Liz has put a draft one together. We will have that out very shortly for consultation, and you will see that before we finalise it. I'm just trying to get to the end of this report because I know it says there what we're looking at next month. At least I thought it was. Perhaps I'm wrong. But there we are. Liz will remind me exactly what we're looking at next month. What do you, Liz?
I will. We're looking at performance monitoring, and an update on the regional adoption service.
Okay, so that's on the programme for next month. Thank you very much for your not perseverance, for your patience in terms of the length of this meeting. It has gone on a bit longer. I think we were discussing two very important areas, and I'm not going to apologise for letting it go on that little bit, but thank you for staying.